Welcome to Change in Condition, Tools for Effective Communication. This is a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. The information contained in this module is relevant for nursing assistants on the front lines of providing care for patients and residents, anyone providing care to an older adult in any caregiving capacity, and those not in a caregiving capacity but are looking for ways to improve their knowledge and understanding of how to effectively communicate a change in a person's medical condition. Superior Health aims to empower you by increasing your confidence and communication skills and using evidence-based tools that guide you in reporting changes of a person's medical condition. The purpose of this course is to further your learning and application of these skills in real-life situations. This learning module, Changing Condition, is a three-part series. You are viewing the second part of the series. The first module gives guidance on how to recognize a changing condition. The second module offers guidance on effective communication skills, and the third is a review of case study. It is not necessary to complete the entire series in one setting, and you can leave and return to the course at any time. Upon completion of this module, you will be able to determine what to report about observed changes in a patient's condition, describe when to report patient information about a potential change, utilize various tools to structure your communication, and lastly, recognize the important role effective communication has on providing care. What and when should you report a change? You are on the front lines. You are the one who knows what is considered the norm for a resident. Noticing subtle changes in residents you are familiar with is how you can identify if the resident might be experiencing a health-related need that they may not be able to communicate. Not only are your own observations important, but observations made by others that are familiar with the resident are important too. Listen to others included in the care team and watch for patterns in their reports. Did the previous shift report say that they thought the resident was sleepier during their shift? Maybe you heard the dietary aide report that the resident was not eating as much as usual. Did the physical therapist note that the resident became fatigued quicker than normal? By listening to what others have to say and coupling it with your own observations, you can become the resident's greatest advocate and help determine if something underlying may be contributing to the changes observed. Timely reporting of a change of condition leads to quicker assessment of the resident by the care team, which leads to better outcomes for the resident. With experience and training, you will get better at deciding when and what to report. Team members with less training or experience should not hesitate to report more rather than less. So if in doubt, report your concern to your supervisor. When starting out with a new situation or a new patient, it can be overwhelming to think about how much you have to pay attention to. But once you are familiar with a person's daily patterns, you will be aware of the things that may be considered a change. Your facility probably has a place to record the vital signs, toileting patterns, activities of daily living, and behaviors of the residents in your care. Be sure to use this to record information from your shift and to read information from previous shifts so you can make comparisons. Always ask yourself, are there any changes that should be watched for or reported? If you feel there is something that needs to be watched, write it in your shift notes. Besides written documentation, a handoff or shift-to-shift verbal report of patient information should happen at shift change or at any other time there is a change of caregiver. This handoff of information is the transfer and acceptance of patient care responsibility achieved through effective communication. It is a real-time process of passing patient-specific information from one caregiver to another to ensure the continuity and safety of the patient's care. Here are some things you can do to support an effective handoff. Use structured communication methods such as checkback, SBAR, and early warning tools, which will be discussed momentarily. Making sure you are using the standard handoff or verbal report process if your facility has one. Decrease the number of distractions by conducting shift reporting in a quiet, interruption-free zone. If you are conducting walking rounds, reporting at bedside, be sure all parties involved understand the importance of completing a shift report without distraction. Do not skip shift reports due to time constraints. The patient's safety and positive outcomes are based on your knowledge and observations of their care. As you are communicating your own handoff, be specific and clear about any concerns. Ask, what questions do you have at the closing of your report to clarify anything that the next provider may not have fully understood. The checkback tool is a closed-loop communication method. It is used to ensure the information you are sharing with your listener was understood as you intended. It consists of three basic parts: the initiation of the message, the receipt of the message with feedback, and lastly, the person who initiated the message double checks with the listener about their understanding to close the loop. Use the checkback method to ensure your report has been heard as it was intended. When receiving report from your peers and colleagues, model the checkback method. Repeat back resident information you heard to ensure you have understood the information as the person communicating it to you is intending. This example is only a portion of what a full report would sound like, but focuses on what could possibly be a change in condition being observed. The reporting certified nursing assistant, or CNA, notes several things that were observed about a resident during their shift. The CNA receiving the information uses the checkback method along with the early warning tool that will be shown on the next slides to ensure what they heard about Mrs. Johnson was accurate and there may be cause for concern. Sometimes it is hard to identify a change and know when reporting should occur. The stop and watch tool can help with this. Report if the resident you are caring for seems different than usual, talks or communicates less, overall needs more help, has pain that is new or worsening, or is participating less in activities. Report if the resident ate less, had no bowel movement in 3 days, or is experiencing diarrhea, or is drinking less. Report if the resident has had a weight change, seems agitated or nervous more than usual, is tired, weak, confused, or drowsy, has a change in skin color or condition, or if they need help with walking, transferring, or toileting more than usual. The early warning tool is a form that caregivers can use to write down what they have noticed about a patient's condition. It is a brief guide through all of the early changes that can be signs of an illness. Its purpose is to help you communicate about the change with other providers. The form should be completed by the direct staff member who noticed the change anytime a patient has had a change. A link to the early warning tool is provided in the additional tools and resources section of this module or in the YouTube description below. Take a look, and if you have used one before, try filling it out for a patient you have taken care of most recently. If any changes are noted on the early warning tool, report that to the nurse before the end of your shift. The early warning tool should not take the place of talking to the nurse, but it can help the caregiver remember everything he or she wants to tell the nurse about a patient's changing condition. SBAR is an abbreviation that helps you to remember how to communicate a change. S for situation, B for background, A for assessment, and R for recommendation. When you identify a change in condition, report it to the nurse or your supervisor. Following your report, the nurse may complete an assessment. If the change continues or worsens, it is important to report again. For direct caregivers reporting a change, your focus should be on describing the situation and background surrounding the change. The assessment and recommendation may be completed by the nurse when reporting upward. Consider the following scenario. Your day with Mrs. George started off with her almost falling while assisting her to the bathroom. She lost her balance and stumbled, but luckily you were able to steady her. She said she was not hungry this morning, but you did convince her to drink some orange juice. After breakfast, she asked to rest in bed for a while. Usually, Mrs. George is the first one up ready for therapy, and breakfast is her favorite meal of the day. Something seems to be wrong with Mrs. George, and you decide to report your observations to the nurse. Using the SBAR tool, your conversation would proceed something as follows. Mrs. George, in room 34, is acting differently today. She stumbled but did not fall on the way to the bathroom. She would not eat breakfast, but I got her to drink some juice. She requested to go back to bed after sitting up only about 10 minutes and refused therapy. Yesterday she was fine, she ate well, and participated in therapy. Something seems to be going on with her. Could you go check on her soon? CUS is a way to emphasize concern. If you are communicating with a fellow team member and worry that your communication is not getting through as intended, CUS may be helpful. It stands for concerned, uncomfortable, and safety. You may say something like this. I am concerned that Mrs. C is not her usual self. I'm uncomfortable that she is behaving so oddly. I believe she is not safe. She may have something serious going on that we are missing. CUS can sometimes overcome barriers to communication by emphasizing our personal stake in our patient's well-being. It should not be used routinely, only use CUS when the situation is urgent. Noticing changes in patient's condition is important, but by itself is not enough to ensure patient safety and well-being. Changes must be detected early and communicated promptly across the care team. A safe environment is based on good communication. Everyone is responsible for speaking up about safety concerns and changes in a patient's condition, and everyone's input should be welcomed. In a safe environment, no one is trying to place blame, rather, everyone is working to determine what is best for the patient. We can improve our reporting on changes in patient conditions by using one of the several tools learned today, such as the check-back method, SBAR technique, early warning tool, or CUS, which can help structure communications. I invite you to check out the resources listed here to learn more about communicating change in condition for your patients. It is now time to test your knowledge. Click the link for Change in Condition, Tools for Effective Communication quiz on the Frontline Forces webpage or in the YouTube description below. This material was prepared by the Superior Health Quality Alliance, a quality innovation network quality improvement organization under contract with the Centers for Medicare and Medicaid Services, an agency of the U.S. Department of Health and Human Services. Views expressed in this material do not necessarily reflect the official views or policy of CMS or HHS, and any reference to specific product or entity herein does not constitute endorsement of the product or entity by CMS or HHS.